Exercise Physiologist and Tailoring an Exercise Plan for Wellness. Your presenter is Mr. Eric Morales and I'm your facilitator, Jen East. We acknowledge and pay respect to the traditional custodians, past and present, on whose land we meet today. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country and respect the cultural authority of the elders in each community. So just a little bit of an introduction to Eric. Eric is an exercise physiologist and he was been working at the MS Centre at Lidcombe for a year. He completed a Bachelor of Exercise and Sports Science degree and then went on to complete Masters in Exercise Physiology degree. His interest that he enjoys staying active and on the move, he's passionate about exercise in his own life and also as a way of assisting those with MS to improve their function and outlook in life. He loves the positive and can-do attitude of all clients, despite the many barriers clients with MS face.
Thanks, Jen. So before I start, can I just confirm that everyone can see my screen and that's all good, Jen?
Yes, it's all good, Eric.
Beautiful. All right. Okay, so hey guys, first of all, thanks, Jen, for the lovely introduction. And more importantly, thank you to everyone who is tuning in for today's webinar, which I hope will be very informative and leave you with a sort of, that's very interesting sort of vibe, okay? Now, as mentioned, this presentation is an opportunity for me to highlight two things here. Number one, we're going to delve into the role and benefits exercise can have in people with multiple sclerosis. And number two, I really want to emphasize the role of an exercise physiologist. Now, as far as I'm aware, there hasn't been a webinar highlighting the role of an exercise physiologist. And the profession as a whole is largely in the unknown within the healthcare space. And this is despite what I believe is a EP can play a crucial role. So hopefully we're able to really get something out of this webinar today. I think it's also important to note that the webinars have been split into two sections. So as I just mentioned, I'll be discussing more so the role of an EP and exercise, which then sets the foundation for the next webinar, which more so focuses on exercise guidelines, types of exercise, and the barriers to exercise and how to overcome them. So definitely stay tuned and I hope you guys really get something out of these upcoming webinars. So before we get the ball rolling, here's a quick outline of how today's webinar will look. First off, I'll start by discussing the role of an EP and then dive a bit deeper into the relationship between exercise and MS. So without further ado, let's get the ball rolling here. Now, in order to really understand the role of an EP, I think it's important to first of all understand and cover the what and the how of an exercise physiologist. So I guess the golden question here is, what is an EP? So essentially an exercise physiologist is all things exercise and really uses the potent effects of exercise to its full advantage to manage a wide range of health conditions. So as shown in the slides, an EP is equipped with the knowledge to evaluate, design, and deliver effective exercise interventions for a wide range of health conditions. How exactly this is executed within an MS setting will be discussed further on in the presentation. So let's just briefly run through the how now. Like any other allied health profession, whether it be a physio, an OT, or any other profession, a university qualification is required. So for an EP, that's 4 years of university study, consisting of 500 hours of clinical placement in various population groups, ranging from respiratory conditions to neurological conditions, such as MS. So now that we have a basic understanding of what an EP is, a question I get asked a lot is, what's the difference between an EP or physio? So I guess the best way to understand the difference is to break down each profession, analyze and then apply this into a real life setting to give this all some sort of context and just to make sure it makes a bit more sense. Now, the reason I believe there can be a lot of confusion or why it's not so black and white is because there is some overlap between the two. In saying this though, I do believe each profession, so the EP and the physio, can add some added value in their own way. So let's look at this a bit more. So let's start with an EP. So as mentioned, an EP is all about the safe and appropriate and effective delivery of exercise interventions to treat and manage conditions. This not only includes exercise interventions, but it's also approached with an emphasis on the overall health of the client. So in the context of an MS client, yes, the client's main concerns, whether it be their gait or leg weakness, is a big issue and the main issue, right? But as an EP, what we do is not only consider these main issues, but also have a greater outlook or scope and consider all the health issues, whether it be someone's grip strength, blood pressure, or their psychological well-being as well. So I think this holistic approach, focusing on a client's overall health and well-being, is what really defines an EP and makes an EP a real valuable asset. So now in regards to a physio, there's no doubt as well that they form a real integral role in the management of a client. So my take on a physio is this: a physio is more so about the assessment, diagnoses, and implementation of various interventions, ranging from massage to exercise as well, and then also assistive technology. So whereas perhaps EPs have a greater focus on exercise, physios can also have some focus on exercise, but also in assistive technology. So for example, a client has foot drop, which is quite common in MS, affecting the gait. So what a physio might do is they might prescribe a dictus band, which is a device that assists in lifting the foot off the ground. Now, an EP would further add targeted exercises focusing on the foot drop issue. So therefore, the combination with the physio and the EP combined together ultimately lead to better patient outcomes in the long term. So hopefully putting the EP physio relationship into context has cleared things up a bit. But if not, if I still sort of lost you guys a bit, please bear with me, because what I'll do is I'll further explore the relationship between EPs and physios here at the MS clinic in Lidcombe. So as we can see on the slides, the main role of an EP involves running through the exercise programs with the clients, modifying the program as we see fit, whether it be due to a need to progress the exercises or change things up due to the fluctuation of MS symptoms. And I think it's also important to note that the EPs also provide a real vibrant and uplifting environment, which is, I think, really important and really key. On the other hand, so we have the physios who have a greater focus on providing regular physio assessments and one-on-one consultations, which actually works really well given the group setting of all EP sessions. Now, as well as this, the physios are also able to prescribe assistive technology ranging from walking aids to AFOs and to dictus bands, as I mentioned before. So I guess the main thing to take away is that each profession does add value to the overall management of a client. And I think this is actually really well done here at the MS clinic. So I've touched on the MS clinic, so I thought I'd just provide a very brief overview of the MS clinic. So we have 3 EPs working here with a wide range of MS clients, all in a group setting. Now, although sometimes we are known as the slave drivers of the gym, all clients really do enjoy the exercise setting here. And this isn't just due to the physical benefits, but also because they're exposed to like-minded people, they're able to feed off each other, And it really does provide a social and psychological benefit as well, which is actually really important for people living with MS. So in terms of accessing exercise physiology services through one's NDIS plan, this can be done through either improved health and well-being or improved daily living. So if you're not already accessing regular exercise services, then I strongly implore you to do so. I'll explore the reasons why in the following slides here, okay? Now, when we talk exercise and MS, we tend to solely focus on MS, and this leaves the impression that MS is actually the only health concern. So although, yes, MS is in the driver's seat, so to say, it's important we don't forget the passengers as well. So if we could acknowledge and understand why and how exercise affects our overall health, we can hopefully see the added value exercise can really have. Now, I really love this quote here. Regular physical activity is one of the most important things you can do for your health. It really does provide a really succinct summary of the next few slides and really sets a tone for the remainder of the presentation as well. Now, let me just provide a put this into context. Now, if your doctor prescribes you medicine and tells you, look, take this and it'll help you manage your current health problems and it'll make you feel better, what do? Well, we take the advice on board and we take said medicine. Now, what if I told you that to exercise regularly and participate in some form of physical activity every day and it'll help manage your health? Well, more likely than not, we don't, right? Now, there are many reasons for this, yeah? So, but my job today is not so much to focus on the barriers to this. That will be focused more so in the upcoming webinar. Instead, my job today is to set the foundation for this and to enforce or perhaps reinforce, hopefully, the significance of exercise. Now, what we know is this: exercise is medicine and should be used as a frontline defense. Now, why is this, Eric? Well, let's analyze the table here from the World Health Organization. What we can see is this. Number one, physical activity positively influences 5 out of the top 6 leading causes of death. Yeah, so that's 5 out of the top 6 leading causes of death that can be positively influenced with exercise. So just let that sink in and, let that really drill in, okay? Now, despite this, although research isn't as such consistent on the set percentage of people with MS not exercising regularly, there's no doubt that there is a very high level of people with MS not participating in regular exercise. Now, so the beauty with exercise and MS is that they work really well together. So what I mean by exercise being a double-edged sword, which is on the slide here, is this. Number one, or sword one, exercise benefits the many symptoms, whether it be muscle weakness or fatigue or any other common MS symptoms. And then number two, or sword two, is the fact that exercise does benefit from the accumulation of secondary diseases such as heart disease, stroke, and all those other conditions. So from this, there's no doubting the benefits exercise can have in one's life, and therefore should really be a part of one's daily routine. Now, in saying that though, this doesn't mean that I'm expecting you to go do a 5K marathon after watching this webinar, or do laps around your local park. You know, each person with MS is different. But perhaps the most important thing to note or to do is do that what is possible for you. So this is really nicely summarized in the quote here. And in saying that, also do urge all you guys as well to really, you know, look into some further research or readings. Yeah, we'll go from there.
I've actually got a question, Eric, which, links in nicely with what you've just said about trying to do, whatever you can for yourself, depending on your own conditions. Is a question from Lynn. She says that she uses a wheelchair, and what types of exercises could she do?
Right. Yep. Good question, Lynn. So thank you for your question. So when we're looking at the wheelchair, I guess it does depend on what you want to achieve, and your level of mobility as well. So like all these things have to be taken into account. But if I'm just basing this off maybe a client who is in the gym, who's in a similar situation in a wheelchair, there can be leg exercises that can be done, whether that be knee extension exercises, so strengthening the front of the legs. Could be some stretching exercises as well. It doesn't have to be all the strengthening exercises. Stretching as well is really important, and I'll focus and talk a bit more about why later on in the slides. But yeah, I think just knee extensions can be a good exercises to do. Hip flexion, so trying to lift your foot off the ground, can be another great exercise. But once again, without really seeing the client, it's really hard to tell them what to do. But I guess that's just sort of a general sort of guideline of what can perhaps be done.
Yeah, that's great. And I think it just draws to your point about, working out what can be done for you specifically and making the most of what you can.
Exactly, yeah. And like I think, and another thing that I'll note is the best movement is your next one. Okay, so yes, it's important to hone down on what exercises and whatnot, but also just keeping moving. Just maybe starting there is a good starting point for someone. So yeah. All right. So I'll continue on, Jen.
Yep.
Now, so I talked briefly about the role of exercise in the general health and well-being. Now I'll talk specifically more so relate to the MS, some common MS symptoms. And so what I've done here is to make it really clear is to list some of the main MS symptoms and then link some of those symptoms which have been shown to benefit from an exercise intervention. So for example, muscle weakness and balance is a real prominent issue within MS and one we see here quite often. So what research has shown is that these symptoms can be better managed. So keyword, they're being managed with an appropriate exercise intervention in place when compared to no intervention at all. So no exercise or physical activity. So I'll go into the research a bit more later on in the slides. But I guess this just once again reiterates the huge benefits exercise can have in MS and your general health. Now, the thing with exercise is that we can't deposit it into some sort of a bank account. It's not a matter of exercising really hard for 1 week and then expecting those effects to drag out for several weeks later. Exercise doesn't work that way and instead requires frequent attention and consistency. So although I consider myself a good saver and financially smart, I do have to stay consistent and with exercise myself, yeah? So now with MS, due to the lesions in the brain and spinal cord, motor and cognitive changes become apparent. And it's often these cognitive changes which are often overlooked. And this can be due to cognitive changes being less likely to present so, when compared to a motor issue, such as one's walking pattern or muscle weakness. So with aging, what we know is that the brain reserve reduces. It's a given and part of the aging process. But what we also know is that with MS, unfortunately, this process occurs at a more rapid rate and even more so in progressive forms of MS. So why is this important? Well, to understand that, it's probably best if we define what brain reserve is, first of all. So brain reserve is a brain's resilience. It's the ability of the brain to cope with increasing damage while still functioning adequately. So we can then put two and two together and correlate a reduced brain reserve with an increased level of cognitive impairments. And so this ultimately affects our independence and quality of life, just as any of the other motor issues, such as walking pattern and muscle weakness would. So brain health becomes especially critical with MS, and we'll discuss the role exercise can have on this in the next slide. So when looking at the role and benefit of exercise, yes, it's important to consider all three areas here. So in the previous slides, we discussed more so the functional benefits, such as increased strength, mobility, aerobic fitness. But to carry on from what I was just discussing in the previous slide, we'll focus more so on brain health and exercise. So the brain literally depends on exercise or physical activity for its growth and maintenance. And the reason I say that is this: when we exercise, we release nerve growth factor and brain-derived neurotrophic factor. And so together, what they do is they function to stimulate the growth and maintenance of the connections and pathways of the brain. So the way I like to look at this, and just to put the role the brain and exercise relationship does have together, I like to look at it like this. Think of exercise as a gardener. Now think as the water being released from the gardener as the important hormone. So that's the nerve growth factor and brain-derived neurotrophic factor. Now think of the grass as a brain. So let's break this down. So we have the gardener as as exercise, water as the brain food, and the grass as the brain itself. Now, what happens if we don't water the grass? It doesn't receive the bath of water it needs for growth and maintenance. And so what does this result in? It results in the grass beginning to die. So this is a similar concept with exercise or physical activity with the brain. Our brain needs that bath for ongoing maintenance and growth. And with exercise, we therefore aim to slow the progression of brain volume loss, which ultimately provides an improved state of mind and health as well. So when we're thinking of the benefits of exercise, it's important that we don't only acknowledge the functional benefits, such as strength, mobility, and balance, but also take into account the anti-inflammatory effects and the brain health effects exercise has. So therefore, just no matter your level of mobility, whether in your wheelchair or you have an assistive device or you're able to mobilize well, focusing on this brain health and the anti-inflammatory effects, and not so much only on the functional benefits, I guess really opens exercise up to everyone, just no matter what your level of disability is. Now, before we dig into the research regarding exercise and MS, let's very briefly touch on a few things here. First off, it's important to note that research isn't the be-all and end-all, yeah? So instead, what we must do is take into account the research findings, and the quality of the research as well is quite important. And then see how we can approach and integrate this into a clinical setting. Because at the end of the day, it needs to work for you. So for example, if a research article recommends exercising 4 to 5 times a week, well, that's great and awesome. But what we then must do is then consider the individual client themselves and see how we can perhaps reach this level of frequency, or how we can compromise as well with the client. So I guess what I'm trying to say is that instead of just copying and pasting the research into a clinical setting or into your daily routine, what we must do is copy, analyze, and then integrate the research into a clinical setting or into your daily life. So let's have a look at some of the research very briefly. So I won't go through each research point here. So the research findings from each study have been summarized for your convenience. So what I'll do is I'll go through the next couple of slides, and I'll let you guys have a read of the research findings a bit later on. Yeah. So then once again, just some further research findings on the effects, different exercise interventions, whether it be strength anaerobic exercise or strength or aerobic exercise on itself. So
I think the benefit of this type of stuff, Eric, is that knowing that being referred to an EP, that clients know that the EPs have the research behind what they're doing and what they're suggesting, and the reasons why they might be modifying a particular exercise for that particular client. So, it's quite handy to have this information so people can see, oh, my EP actually gets it. It's really good.
exactly right. Yeah, that's exactly right. It really provides a succinct summary, really. So yeah.
Mm. We've got a fair few questions, all the same questions, so I'm going to ask it now if you don't mind.
Yep.
And it kind of varies a little bit from how do you get a referral to an exercise physiologist, and how do you get a referral to an exercise physiologist who has a neurological background if you don't live in an area like, around Metro Sydney, for example?
Right. Okay. So I guess to start off with, the first question is, how do you get the referral to the exercise physiologist here specifically, or was that
An
the question?
exercise physiologist,
Yeah. So
anywhere.
anyway, I mean, you don't have to get a referral from a doctor, so to say. What I suggest is, and I guess it depends. So, for example, I know some clients have support coordinators. It, of course, depending if they're on the NDIS, and so the support coordinators can really help you with that. But if that's not the case, there are a lot of different clinics around Sydney that really have a neuro sort of background, and especially with MS. So I know there's one in, further North Shore, St. Leonard's area. Um, but I guess the best thing to do is just to do, I guess, some bit of research as well.
I know that people can
MP.
get EP through their chronic disease care plan through their GPs. So you can have a referral for 5 exercise physiologists through that care plan. So it might be worth
Yep.
for those people who aren't in a metro area to flag the idea of an EP with their GP. And they also might have some access to neurological based clinics. So in some of the, outer Melbourne, in Sydney, and other metro areas, there's usually a neurological kind of alliance. But GP first and foremost, I would say,
Yep.
unless you're NDIS funded, and you can, as Eric said, use your funding for an EP.
That's right. Yep. So did that answer the question, Jen?
Yes, yep.
Okay. Was there any other questions?
There are lots,
Oh,
which is
great.
great. The questions are coming in thick and fast, which is great. And somebody, thank you, Caitlin, has talked about the ESSA webpage to find an accredited exercise physiologist as well, which you mentioned at the start of the presentation as well.
Yep.
And also people have said they're in regional places and, what do you suggest? But, I suggest going to your GP. Yep.
Yep, that's right. Yeah. Okay, so
I'll leave you to it.
I'll move on to the next slide. So what I'll do is in the next slide, I'll provide a sort of summary of what these 2 research articles suggest. So, as I said, what we can draw from the conclusions of the research is this. Number 1, the benefit of exercise seems to be indisputable, okay? And number 2, although there is various research into exercise, there doesn't seem to be a large amount of high quality research. So what I mean by that is that there is a lack of like clear-cut discussion regarding the exercise type, the intensity, as well as some of the objective measures which really impact on the results as well. So for example, using a questionnaire as an objective measure really doesn't cut it, and I have seen some research articles that do use a questionnaire as an objective measure. And the reason I say that is because a questionnaire can be highly subjective when it's conducted at a particular time. So what we want to do with any research and to find if there is an effect, we want really good objective measures, okay? And so not something that's based on someone's feelings or assumptions at a particular time, which some questionnaires can do. Now, perhaps just as important, or even more so, is outlining what the research didn't tell us. Now, I briefly touched on this before, but what we must remember is to implement the findings into a clinical setting or into your own setting and make it work, right? So you could have the best program ever, right? But if it's not enjoyable or doesn't fit within the schedule of a client, will it get done? More likely than not, it won't. So let's consider the findings, but also let's make it individualized to a particular client. More often than not, when it's enjoyable and specific to the client's needs, it will most likely drive that commitment to regular exercise in the long term, which is what we really want to strive for here. Now, hopefully by now, we can agree on the huge role exercise has, hopefully. But what types of exercise should form an exercise plan then? Now, I know this will be touched on a lot more in the next webinar, but I just want to make a few brief points here. Resistance training, stretching, aerobic exercise, and balance should form the core components of an exercise plan. So is there an exercise in particular for each category? Short answer is no. And the reason I say that is because it's hugely variable, and it just depends on the ability of the client and what that particular client is able to achieve. But let's talk about the why for each category very briefly. So let's start with the resistance training and the why, I guess. So strength is the foundation for stability and functional movement. So if we don't strength train, our body will not devote its resources to our muscles, and this leads to a downward spiral towards further immobility and muscle loss. So with stretching, I think it's actually quite often overlooked in MS, but it's important to do so for the following reasons. So number one, muscle stiffness and muscle spasms, spasticity are common issues in MS and can be managed with regular stretching. Number two, maintaining or restoring full range of motion is crucial for mobility. So now when we think of exercise, most of the times we think aerobic exercise. We think of, going for a jog or arm crank or those sort of exercise. And yes, it's important to do so because it targets our heart and lungs, which is vital for overall health, but also works really well with other types of exercises and improves our capacity to complete everyday tasks. And
I've
now
got Betty asking. I've got Betty asking if that includes housework, or whether she needs to be doing more.
See, and then that's where I've said exercise or physical activity. So exercise is more of a structured exercise plan, so that includes all these sort of different components. But that's where the physical activity, so the housework, the gardening, is also really important. And it doesn't it doesn't have to be always going to your local gym or to an MS clinic center or whatnot. It can just be a matter of just staying active, staying on the move. So yeah, definitely housework and gardening or all the other house chores that got to be done definitely plays a big role as well. So yes,
Thanks, Eric.
that's a big tick. And so the final one is balance. So it's been reported that 50% of people with MS report a fall in the last 6 months. So this in itself warrants some form of balance exercise to be part of their overall exercise plan. But in saying this, what the other thing that balance does is that it improves our ability to sense where things are in space, so where we are in space. So for example, if we're walking and there's obstacle, that all that balance training and balance exercise really allows us to sort of gauge our environment a lot better. So what this does is that it ultimately does help in managing and reducing the risk of falls. And I guess also quite important is improves your confidence in your own mobility. And, so this can have a spiral to, if they have improved confidence, and it can lead, to you achieving more things, getting out, and so ultimately improving your independence and quality of life, I guess. So for the reasons that I just briefly mentioned, I think these should form an exercise the core exercise plan. Now, of course, given the variability with MS, some areas of focus more so than others for a particular client. But generally speaking, of course, these 4 areas is what usually gets it done most of the time. So we've talked about the benefits of exercise, we've touched on the core components of an exercise plan in the previous slide. So now let's come together and let's go through a case study here. So here we have Lily. Lily is a 53-year-old mother of two diagnosed with relapse remitting MS in 2001. Due to current disability level, Lily has reduced her working days to 2 times a week as an admin assistant. Lily is also quite sedentary and mobilizes using a walking aid. So Lily presents to the MS clinic, quite eager to begin the EP program, which is great. But in saying this, and I guess it's also important to note that Lily did mention that there is a lack of home support, social interaction, and increased difficulty performing daily tasks were also identified as, having a huge role in her psychological well-being. So if we go further on into the assessment, we can see here the main issues with Lily involve muscle weakness in the first point, spasticity, which is that feeling of, it's a constantly contracted muscle causing that feeling of tightness that a lot of people can have. Poor balance was another one, gait, reduced grip strength, affecting everyday tasks such as cutting food and carrying groceries perhaps, excessive fatigue, and psychological well-being was a sort of a red flag as well. So let's work through this together. Sometimes what tends to happen is we get lost in all this information overload. So let's break it down and have a systematic approach to things here. So if we think back to the role of an EP, it's exactly this: evaluate, design, and deliver an exercise plan that works for that particular client. So let's go through each phase in a bit more detail. So evaluate. So let's summarize the information we've been given and make it a bit more clearer, so then we can then draw assumptions or look to focus on a particular point. So here are a few dot points, providing an overall an idea or picture of Lily. So I'll move on to the next slides and sort of hone down on the last dot point, which is more of the physical and psychological issues a bit more. So in the previous slide, we've evaluated the information given to us. So now let's design an exercise plan that targets the concerns raised in that evaluation stage. So it really is as simple as this. Number one, identifying the issue. And then number two, coming up with a plan to manage or address that issue. So once again, this sets the foundation for the next webinar series, which look more at the type, the intensity, the frequency of exercise. But what I want to do is I want to more so outline how we can link the issue and the intervention to come up with an effective exercise plan or exercise prescription. Now, the reason I don't have any set exercise or whatnot, because as I said, the nature of MS is really variable. So, something balanced training exercise for one person might not be achievable for another. But I think the main point to take out of this is doing some form of resistance training, some form of balance training, some form of gait training, well, in the scenario for Lily, at least. And also, I think it's also important to note that the reason I have the question mark next to the group exercise setting, so although what we find is that being in a group exercise setting actually works really well here. I know this isn't always possible for a lot of clients, as some of you guys maybe a bit further out in rural areas, maybe, or a bit further away from the metro Sydney, I guess. So we've outlined the issues in the previous slide. So now it's more so about coming up with a plan to target these issues and allow us to deliver the exercise prescription in an individualized and enjoyable manner. So when we have a systematic approach like this, it really does give us a clear direction of the direction or the path we want to take. And it really allows everything to flow a lot more smoother and quite nicely. But once again, as I mentioned previously, yes, we have the issues at hand and then we know what we've got to do. So for example, she has a lot of tightness in her legs. We have to do stretching, but at the same time, we also got to work with the client, see what works, what doesn't work, and sort of have a holistic approach to things as well. And I do love this little picture on the side here, which once again provides a really succinct summary of what I'm trying to hone down: exercise, 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 or physical activity, whether that be housework or gardening or whatnot. So just to summarize here, here are 5 key messages to take away. So first off is exercise medicine. Exercise is really good for you. EPs can play a significant role in symptom management and improving one's health and well-being. So an exercise program should focus on the core issues of that particular client and their MS symptoms, taking into account, as I said, the MS symptoms and the level of disability as well, and what can be achieved. It's never late to start moving as well, is another important one. And I think what's really important is that you do have the power to improve your current situation. And, you know, it's always, I think the main thing is to start moving and, you know, do what is possible for yourself. So now to wrap things up, I'll leave you with this quote, which really drives home the power of exercise. And hopefully I've also been able to portray this in the webinar today. So the single thing that comes close to a magic bullet in terms of its strong and universal benefits is exercise. So thank you all for listening, and I really hope you were able to get something out of today's webinar. I'll be happy to take some questions, but also, as I understand, there is quite a lot of questions. Please feel free to email me at any time that works, because that can also work quite well. And I'm always here to lend a helping hand and assist in any way that's possible. That's why I love doing my job, and yeah, so I'm always here for everyone. So yeah, thank you guys for listening, and I'll pass over to Jen.
Thanks so much, Eric. And I think, you know, as you've alluded to, there is a webinar coming up on the 28th of August, which is about getting active with MS and some different types or different ways of getting active with MS. But I'm glad that you've been able to provide an understanding of what an EP does and how the importance of having a structure behind the exercise that is prescribed and is carried out can really make such a difference to people with MS. So thank you, Eric, for being able to explain that to us today.
Thank you.
There's been, as I said, lots of questions about, you know, how people access an EP, which I think you've answered before. and also lots of praise that incidental exercise such as housework, you know, and just moving, you know, has given them some positivity around what they're already doing. So thank you for all the comments relating to
Yeah, that's great.
you know, yeah, because I think too that the idea of exercise, as you said, for some people is off-putting, because, you know, finding the motivation to exercise. And I think that if you know, lots of people are feeling quite reassured about the incidental nature of some of the exercise, but also feeling that confidence that now that they can seek out an exercise physiologist because they know what they do, to, you know, make a little bit of a plan. I think also if you know, now that having that information behind you, if you felt, I suppose, game enough to ask your GP or seek out a exercise physiologist yourself, you know, moving on to the next webinar might help you overcome some of the barriers that you have to exercise. So that would be really worthwhile activity if you've got the time on the 28th of August. So other than that, I think we will sign off unless anybody's got some last minute questions. As Eric said, if you do have any or things come up, you can either email education@ms.org.au and we'll forward those inquiries on to Eric for him to answer. So don't feel, you know, if something pops up for you later on, then, you know, feel free to let us know. So I'll take back control now, Eric.
Okay, thank you. Thank you, everyone.
Thanks, Eric. Okie dokie. So just we do this at the end of all of our webinars. If you haven't been in a webinar before, we just let you know what's going on at MS. If you want to access some free ebooks, please do. MS Connect can provide you with the contact details there. We also just wanted to highlight the peer support program, which is a really fantastic program that's run by the Education and Wellbeing team. We provide peer support to people with MS, their carers and families, that provide practical and emotional support for people who also live with MS. We have face-to-face support groups, one-on-one telephone matching, telephone-based support groups, and telelinks, which link up a group of people, and we have guest speakers come in. So if peer support is something that interests you, please feel free to give MS Connect a call and they'll link you up with the peer support coordinator in your state. Eric did talk a little bit about the NDIS, and we are a provider for the NDIS. So we also have the ability to just provide you with some information about linking to the NDIS if you haven't done so. So it's a scheme for people under the age of 65, whereas My Aged Care is for people over the age of 65. We will help you understand the eligibility requirements of the NDIS, how to get in, how to prepare for a pre-planning conversation, develop your goals, and we also provide some advocacy if people are having difficulty with the NDIS. So we do a range of things, and exercise physiology, as Eric has mentioned, is one of those things. We also have physiotherapy and occupational therapy in New South Wales and Victoria. As I said, My Aged Care is the service that is available for people over the age of 65. If you want to, you can have a look at the My Aged Care website or give them a call to find out what services you might be able to have access to. So thanks again for your support of our webinar program, and thanks for being on board today. It's really lovely to spend the afternoon with you. If you wanted to hang on for a few moments at the end of the webinar and complete a survey, that would be fantastic, just to give us some feedback on where we're up to with the webinar program. But thanks again. I hope you have a really great day, and we look forward to welcoming you on board next time. Bye.